Hello, I hope everyone's doing well today. My name is Dr. Simo, and our case is regarding atrial flutter and one-to-one atrial ventricular conduction in a patient with chronic alcohol use and hypertension. Our team is from Ascension Genesis Hospital, and we have no relevant financial disclosures. Atrial flutter is a rhythmic disturbance caused by problems in the heart's electrical system and occurs when the chambers beat faster than normal and potentially in an uncoordinated fashion. Atrial flutter typically results in an atrial rate between 250 to 350 beats per minute, with the ventricular rate being a fraction of the atrial rate due to decremental conduction properties of the AV node. Commonly in atrial flutter, the AV conduction rate is 2 to 1 or 4 to 1, but in rare cases such as our case, you can have atrial flutter with 1 to 1 AV conduction. This is often associated with conditions such as hyperthyroidism and the use of class 1 antiarrhythmic drugs, an underlying accessory bypass tract, or increased sympathetic activity, and it significantly increases the risk of stroke, heart failure, and hemodynamic failure along with other complications. Chronic alcohol consumption is a well-known risk factor for the development of various cardiac arrhythmias due to myocardial damage, autonomic dysregulation, and electrolyte disturbances. This case report aims to provide an overview of the comprehensive management and long-term strategies addressing underlying risk factors. Our case is regarding a 64-year-old female who presented to the emergency department with worsening weakness, palpitations, and chest pain over 3 days. She has a past medical history of chronic alcohol and tobacco use, hypertension, COPD, and was not compliant with her medications. Otherwise, she had no prior cardiac history. On EMS arrival, initial vitals showed a heart rate of 260 beats per minute, and EKG showed narrow complex tachycardia. She received 6 milligrams of adenosine, and EKG showed atrial flutter with 101 conduction. This can be seen in the top right image. She maintained a blood pressure of 168 over 115 and therefore was given IV cardizem and started on a cardizem drip. Subsequent EKG showed atrial flutter with 2 to 1 and then eventually 4 to 1 conduction. The 4 to 1 conduction can be seen in the middle image. A transthoracic echocardiogram revealed a mild left ventricular hypertrophy and normal left ventricular systolic function with no other significant abnormalities. She was started on anticoagulation with Eliquis and scheduled for synchronized cardioversion after transesophageal echocardiogram. She was successfully converted to sinus rhythm. This EKG can be seen in the bottom right image. Electrophysiology was consulted for ablative therapy and options were discussed with outpatient follow-up and management. She was consulted on alcohol and tobacco cessation and discharged home with close outpatient follow-up. Chronic alcohol consumption is a well-known risk factor for the development of various cardiac arrhythmias, including atrial flutter with 1 to 1 AV conduction. The initial management involves rate control, typically achieved with AV nodal blocking agents. Adenosine can be used to reveal atrial flutter and differentiate between other causes of narrow complex tachycardia. Long-term management involves addressing the underlying risk factors, such as optimization of blood pressure and abstinence from alcohol. Ablative strategies can offer a curative approach for typical atrial flutter. To conclude, this patient was treated promptly with rate control strategy as she remained hemodynamically stable. She eventually was cardioverted to sinus rhythm after initiation of anticoagulation. This case highlights the importance of comprehensive management, including rate control, rhythm restoration, and long-term strategies addressing underlying risk factors. Further research should focus on long-term outcomes in managing alcohol-related arrhythmias and the role of lifestyle modifications in preventing recurrence. Early recognition and prompt treatment of atrial flutter with rapid ventricular response are critical to prevent hemodynamic compromise and improve outcomes. Thank you for listening and thank you for everyone's time. Have a great day.